Hello, my name is Noemi Beck-Wegner. I'm the clinical director with Sacramento County START Services in Northern California. And our project was a demographic review of our current individuals that we serve within our program. So we have a very new program, so we only have 26 individuals. And we were primarily looking at history of trauma exposure experiences, trauma-related diagnosis and treatment history, as well as reported symptoms, looking at the ABC and RSQ. We are focused on identifying trauma-related experiences that these individuals have and see if they have had trauma-related diagnosis, and especially looking at if they had trauma-related treatment based on the experiences that they have reported or have had in their history. The reason we focused on this because we have seen in research that there is an elevated risk of experience and or exposure to adverse and traumatic events in people with IDD. However, there is a big gap when it comes to having an assessment tool as well as having treatment that is trauma focused for individuals with IDD, especially that population. So we wanted to see if our results were in agreement with the research. And we have found that out of the 26 individuals, 25 of them had multiple history of trauma experiences and or exposures. Only 6 of them had actually had a trauma diagnosis of PTSD or closely related to it, and only 1 of them had trauma-related treatment. Some of the traumas that we looked at were physical trauma, sexual trauma, exposure to domestic violence, substance abuse within the home, neglect, medical trauma, as well as community violence and school violence. Our finding has shown that most of our individuals have multiples of complex trauma that they have experienced and have not received treatment that is targeted to those symptoms and experiences. So our next step is to continue reviewing records, do an in-depth analysis of the ABC and RSQ scores, and utilize an evidence-based tool to assess trauma history individuals and to help us identify those histories and tailor the treatment toward that. Thank you, and I'll look forward to answering any questions that anybody might have.